Let's define antagonist first. It refers to a drug that binds to a specific receptor but does not activate it. Instead, it blocks or inhibits the receptor's normal activity, preventing the natural ligand or the neurotransmitter or the agonist from binding and exerting its effect. Now, in order to understand this definition, let's see what is agonist. An agonist is a drug or a ligand that binds to a receptor and activates it, and this ligand or agonist mimics the effects of a natural ligand or a neurotransmitter. So when an agonist binds to a receptor, it triggers a series of biochemical events within the cell, leading to a biological response. The response can vary depending upon the specific receptor and the tissue or organ where this receptor is located. In this example, this is our cell membrane, and this is a cell membrane bound receptor. We may call it a GPCR. The drug or the agonist has been administered, and it's quite happy to take this receptor and produce a biological response in the cell. Now, with the same picture on scene, let's see what is an antagonist. Antagonists play a crucial role in pharmacology research and clinical practice. In research, they serve as valuable tools for studying the functions of specific receptors. In clinical settings, the antagonists are employed to block unwanted receptor activity or counteract the effects of particular agonists or drugs. By selectively inhibiting the receptor, antagonists effectively modulate and regulate physiological processes, thereby offering therapeutic benefits for a range of medical conditions. Imagine a simplified scenario involving an agonist or the ligand and an antagonist. Here is our receptor. This part is the ligand binding or the antagonist binding domain, which accepts either an agonist or an antagonist. You may call this receptor as the simplified version of a GPCR. Although the GPCR or G protein coupled receptor has a relatively complex structure, we will discuss that later on in some other video, but in this video I'm simplifying the concepts basically. Now let's introduce an antagonist into the system. The antagonists are designed to have a shape which is similar to the agonist, allowing it to also bind to the receptor but without activating it. When the antagonist interacts with the receptor, it takes the driving seat and physically blocks the agonist, thus preventing the agonist from occupying its binding pocket on the receptor, and inhibits the desired biological response. The antagonist essentially competes with the agonist for its binding site, or outcompetes the agonist in this case. But as we all know that true antagonists or pure antagonists have intrinsic activity which is equal to 0, so this antagonist will not mediate its own cascade. This antagonist will bind to the receptor without activating it. It will hinder or antagonize the agonist actions and prevent the agonist from showing its biological response. In this video, we are only focusing the basic concepts about antagonists. There are different types of antagonists which will be discussed in other videos that will clarify most of your questions about this topic. So pure antagonists, as I mentioned earlier, do not by themselves cause any action by binding to the receptor. That is, their intrinsic activity is 0. They do not possess any pharmacological response on their own. Let's understand the concept of antagonists by some examples. Now, histamine is an endogenous substance that produces typical symptoms of allergy. Histamine antagonists, commonly known as antihistamines such as phenarmine, cetirizine, loratadine, block the effects of histamine at the H1 histaminergic receptors, and thus they prevent the typical symptoms of allergy such as itching, sneezing, and watery eyes. Naloxone as an antagonist for opioid agonists. Naloxone is an opioid receptor antagonist that can rapidly reverse the effects of opioid agonist toxicity such as morphine or fentanyl. When administered, naloxone competes with the same opioid receptor the morphine and fentanyl are competing for. Depending upon the concentration, naloxone will outcompete the agonist, effectively displacing these agonists. Now, this is particularly important in cases of opioid overdose and quickly restores normal respiration and prevent life-threatening respiratory failure.